My name is Adanna Akujou. I'm a cardiothoracic surgeon. I am the vice chair of the board of directors for the VOOM Foundation. I have worked with the VOOM Foundation for about 8 years now, or 7 years. And I have been a physician for 24 years and a cardiac surgeon for 15 years. Well, I was born in New York City. My parents are Nigerian. Both of my parents are Nigerian. I actually moved to Nigeria when I was 11 months old, and I was raised here. So I spent 17 years of the earliest times of my life in Nigeria. Well, growing up in Nigeria, I was always aware of the health disparities of the haves and the have-nots. And I knew that I wanted to be a heart surgeon, specifically a heart surgeon, when I was about 11 years old. But initially I thought that I would be a heart surgeon in Nigeria. I never knew, even though I knew that there were some healthcare disparities, I never knew how bad the healthcare situation was. We left Nigeria emergently in 1993 after the political mishap, and after I became a cardiothoracic surgeon, I said I want to go back to Nigeria to give back some of my time, since it was a place that I was supposed to practice surgery. And when I started to do my research on how to do that, I became even more aware of the difficulties that Nigeria faced when it came to access to healthcare, access to quality healthcare, and the real dire situation of cardiac surgery. And so I decided that this will become a life's work of mine. So in simple terms, open heart surgery is a surgery that is performed when you enter the chest cavity and you actually operate on the heart, whether it's the vessels in the heart, the valves in the heart, the chambers in the heart, the parts of the heart, or any blood vessel that comes out of the heart. Vascular surgery is surgery on the other vessels. So the vessels that go to the brain, the vessels that are in the abdomen, and the vessels that go to the limbs and the toes and, things like that. So it's the other blood vessels other than the vessels on the heart or directly coming from the heart within the chest cavity. I would say that all the cases spoke out to us for different reasons. One of the cases that I think made an impact to most of us was a case of an indigent patient who had a hole in her heart. And she had a sister who had a child who also suffered from a hole in the heart and actually sadly passed away from a hole in her heart. So I think the diagnosis was very traumatic to the family, and the fear of what would happen to the sister with the hole in the heart in family members who could not afford to pay for surgery. Watching their desperation to have it fixed, their desperation of thinking, can we not afford to do this? And if we cannot afford to do this, what happens to us as a family? And seeing the joy that occurred after they had their procedure. And she's actually on her way home today. It was very touching. Some of the most common vascular cases that we've seen are abdominal aortic aneurysms. That's since we've been doing missions. It doesn't mean that that is the most common vascular case. Unfortunately, a lot of people who have what we call peripheral vascular disease, which is a disease where the blood flow to your limbs, your legs, are not sufficient, are not really seen and evaluated for vascular surgery, because vascular surgery is not something that is done significantly in Nigeria. So a lot of times when patients have decreased blood flow to their legs, they end up getting amputations, when those patients, if they had a vascular surgeon to re-establish blood flow to their legs, either by doing bypasses or opening the vessels with a balloon, suffer from needless amputations if they had the right personnel here. So that is one of the next waves of the mission of the VOOM Foundation, is to educate people about the availability of vascular surgeons And when your foot starts to hurt and you get an ulcer, it does not mean that you have to lose your leg. If you're attended to early enough, someone can establish blood flow and save you your limb. So when someone has, let's say, pain in your leg, or they feel that their leg is cold, or they develop an ulcer, for example, in the leg that does not heal, there could be several causes of that. In a country where people have diabetes can be a cause of that. But to really know the cause, you have to do studies. And there are several simple, non-invasive studies that can be done in your doctor's office, where they can use a blood pressure cuff and just with a waveform measure the blood flow to your leg. And if it's something like diabetes causing that ulcer, those waveforms will be normal. If it's something like bad blood flow causing that issue, then those waveforms will be abnormal. And when you have those abnormal waveforms, you can see a vascular surgeon who can do something called an angiogram. An angiogram is a very simple procedure where somebody can just be made sleepy, and through a little poke in their leg and a little shot of dye can actually see what the blood flow is, and the surgeon can decide the best way to fix the issue with poor blood flow to the leg. And the important thing is training, because sadly in Nigeria there are not facilities, or there are not a lot of people who can do the appropriate studies to diagnose vascular disease. And it's just something simple can save people from the undesired fate of losing their limb. So we have to get to the primary care doctors, the family physicians, and let them know if your patient's leg is cold, if your patient has an ulcer, if your patient is experiencing pain in their leg. These are the studies that you can do to figure out if it's a blood flow issue, and if it's a blood flow issue, send them to a vascular surgeon.